Hi, my name is Christine Walsh, and today I'm going to be validating for setting up a sterile field and changing a wet to dry dressing. So the first thing I'm going to do is I'm going to check the doctor's orders, and I'm going to identify the patient by looking at their wristband or asking them their name. The next thing I'm going to do is I'm going to introduce myself to the patient, gather my equipment. I'm going to explain the procedure to them. I'm going to provide for patient privacy, and then I'm also going to wash my hands before I start anything. So I've done all my 7 steps, I've washed my hands, and now I am going to put on my clean gloves. Okay. Alright, so my gloves are on. I'm going to go to the patient's room. I'm going to make sure that they're okay. I'm going to make sure that they're not in any pain before I start. If there was any pain before I started, I would call the physician and let them know that the patient's in pain and ask them if there's any pain medication I can give. So now I'm going to go in and I'm going to check the wound. And when I pull the drapes away from the patient, I'm going to make sure that they aren't overly exposed, providing for their privacy. And so I'm going to take the top part of this dressing off, okay? And I'm going to put it in the garbage. And then I'm going to take the last 2 parts. I'm going to take the gauze off of the wound. And I'm going to take the wet dressings out of the wound too. And while I'm doing this, I'm assessing for any pain. If there's any discharge from the wound coming out, the color, any odor, its consistency. And while I'm also here, I'm also going to make sure that I record the depth, the width, and the length of the wound to see if there's any changes since the last time the dressing has been changed. So the next thing I'm going to do is I am going to start setting up my sterile field. I'm going to take my gloves off. Alright, I have hand sanitizer in my pocket and Purell. I'm going to quickly just wash my hands with that quick. I'm going to put on a new pair of gloves so that I can set up my sterile field. So I have my sterile dressing over here. I'm going to open it, only touching the outer inch when I open it, and making sure that the white side is up. Okay, so I'm opening up my sterile field. I'm only touching the outer 1 inch of it, and I'm setting that across my table. Okay, so my sterile field is set up. I'm going to open my bowl over here, and the first opening is going to be away from me. I'm going to open it, then from side to side. Again, only making sure that I touch the blue port or the outer 1 inch border. Okay. Kind of just going to wrap this around the bowl so that I could properly place this on the sterile field here. Okay. Okay. So my bowl is on the sterile field. Just going to get rid of this. Now I'm going to start opening my gauze. Again, I'm going to just let this fly onto my sterile field. one seems to be giving me a bit of a problem. Okay. And while I'm doing all of this, I'm just going to make sure that the patient is comfortable, making sure that they're not in any pain while I'm doing this. And I'm going to just be making sure that my sterile field remains sterile by not completely turning my back on it. Alright, so we have our last gauze to open up. Alright, so that's the last of my gauze that I'm going to use. I'm now going to open up my ABD dressing, and this is going to be the top layer of the wound dressing when we are all done. Alright, I'm going to put this in the garbage here. The last thing I'm going to do is I'm going to pour my saline into my bowl. And I'm just going to make sure it's above my bowl and does not touch the sterile field. Alright, so now that my sterile field is all set up, I'm going to don my sterile gloves. So I'm going to put my saline here. I'm going to take my gloves off again. I'm going to take my hand sanitizer, quickly sanitize my hands with that. And I'm going to proceed with putting my sterile gloves on. Alright, so when I open this, I'm going to make sure that I only touch the 1-inch border of the package, because I want to make sure that they remain sterile. Okay, so here we go. I'm only touching this 1-inch border. Alright, so my gloves are open. And the way I'm going to put these on, I'm going to start by putting the glove on my left hand first. And I can touch this outer border, just kind of like to organize the area. And I can touch this part right here because this is the inside of the glove. Okay. All right. Now I am going to put my left glove on. And I'm only going to be touching the sterile side of this right glove. I want to make sure that I don't touch the inside of it, that I did with the other glove. So I'm just going to straighten this glove out over here, make sure it's fully on, only making sure that I touch the outside of each, and I'm just going to throw this out. I'm only going to touch the inside because that's the sterile side. And I'm going to place that in the garbage there. So now I'm going to begin cleaning my wound. This is going to be my sterile hand, and then this is going to be the hand that I clean the wound with. So the first thing I'm going to do, I'm going to grab a gauze. I'm going to put it in my saline. I'm just kind of going to squish it a little bit to get a little bit of the excess water in there. And I'm going to transfer it over. I'm going to go right down the middle of the wound. All right, and now I'm going to bring this over to the garbage. I'm going to get another piece of gauze. I'm going to squeeze it. I'm going to bring it over to this hand and get the edge of the wound. Not pressing too hard. I don't want to hurt the patient while I'm doing this. And I'm going to get another piece of gauze for the other side of the wound. All right. So now that I've cleaned my wound, I'm going to put this last piece in the garbage there. And when I've been putting things in the garbage, I've been making sure that my hand doesn't go all the way in my garbage bag because I don't want to have garbage on my hands. So the next step in the process after I've cleaned the wound, I'm going to pack the wound. So I'm going to take a piece of gauze, I'm going to pass it over, I'm going to put it in my wound here. And then I'm going to take another piece of my gauze. I'm going to put it in the wound again. All right. So now that my wound is packed, I'm going to take one more piece of my 4x4s. I'm just going to lay it over the opening of the wound. All right. And now I'm going to take my ABD dressing and I'm going to lay this over the wound with this blue line up so that I make sure that I get the entire wound covered well. And then I'm going to take my tape and I'm going to tape the edges of the wound, making sure that there aren't any openings. And I'm using paper tape so that it isn't as harsh on the patient's skin as regular tape. Alright. So now that all 4 sides of the dressing are taped down, I have my one last piece that has my name on it, the date, and the time that I changed the dressing of this wound. And I'm just gonna lay it over the top of the dressing. Before I go, I'm going to cover up my patient. All right. I'm going to ask them if there's anything that they need right now, if they're in any pain. I'm going to bring their collet. I'm going to put it by their hand so that they can reach it. I'm going to bring this bed rail back up, and then I'm going to clean my area off. I'm going to wash my hands, and then once I've cleaned everything up and recorded the process, I'm going to record it in the I&O report. And I'm also going to bring my patient back down to a low level so that they don't roll around or possibly fall out of the bed. All right, there we go. And that is it. Thank you.